The first team is going to be talking about the Creating Moves to Opportunity experiment that's already been talked about in this conference so far. The team is a partnership between researchers who are represented today by Christopher Palmer from Massachusetts Institute of Technology, and with the Seattle and King County Housing Authorities, who is representing, Sarah Oppenheimer is representing those authorities today. The main aim of the project is to develop and test which strategies are most effective in reducing barriers for creating moves to opportunity for families who are on vouchers, and specifically ones who have younger children. And so the presentation is going to focus on that today. The second team is going to talk about rapid rehousing programs. And the partnership is between the Lab for Economic Opportunities within the Department of Notre Dame, represented by David Phillips, and the Santa Clara County, represented today by Key Lee. And the aim of this project is to evaluate the effectiveness of introducing rapid rehousing program on outcomes of homeless single adults. So each speaker has about 15 minutes to present, and then we'll open up the panel for discussion. So we'll begin with the first team, which is Creating Moves to Opportunity.
Great. Thanks for having us, and also to all of you for being so interested in investing in these topics. It's exciting to be a part of. Since we're talking about how we blended the research side of things and the practical side of things, I wanted to start out by talking about a broad research frame for what we're doing. And this is certainly something that has been talked about in the conference so far. So this is a map produced by some researchers using data from the IRS and the census to link generations and to try to look at the geography of opportunity across neighborhoods. And so what this map shows is what the average adult income is for a child that grows up in each of these counties that grows up at around the 25th percentile of the national earnings distribution. So growing up in a low-income family that earns around $27,000 a year, how much can you expect to earn as an adult based on where you live? And so there are striking differences across space. And if you think about this being a little bit of a representation of where the American dream is alive and well, where might you expect to earn more than your parents if you grow up poor in America? And so actually, if you average across all of America, the striking fact that's come out of some of this research is that you're more likely to live the American dream in Canada or Denmark than you are in the United States right now, although that masks tremendous heterogeneity across space. And so you can look and see that if you are growing up in a place like Atlanta, you're expected to earn around what your parents did, around $27,000 a year. But if you grow up in, say, Salt Lake City or Seattle or Boston, you are expected to rise up the income ladder. So lest you think that this is all just cold economists that only care about income, these things also correlate with a lot of other interesting outcomes. So the same areas that have high upward economic mobility for children that grow up in low-income families are also areas where girls that grow up there are less likely to have teenage pregnancies, boys that grow up there are less likely to be incarcerated as adults, people are more likely to graduate high school and go to attend college. So that motivated a broad set of questions that we were already interested in, but this kind of academic map, when it hit, it raised a lot of interesting questions, and it raised the specter of place really mattering. And then we talked, Issi brought up, had a great question during the last panel about within versus between. So if we zoom in, here's an example. This is Seattle, looking at the geography of opportunity within Seattle. And by the way, you can pull up a map like this for anywhere in the country at opportunityatlas.org. You can look at your hometown where you grew up or where you're currently living. This is the geography within Seattle, and there's tremendous differences even within Seattle, which scores high on the map when you compare it with other parts of the country. There's tremendous differences across Seattle in what it's like to grow up there. This is a little bit of a puzzle, and you might think, well, maybe it's not causal, because when we've done causal work, the original MTO experiment, a casual observer of that research might have been disappointed that neighborhoods didn't seem to matter that much in the original MTO body of work. So there were important effects that did happen with MTO. It seemed like mental health and physical health certainly improved for single moms that moved to an opportunity neighborhood in MTO, but a lot of the effects that we expected to see, we didn't in the first round of research. And so after seeing this pattern, that motivated researchers to revisit the original MTO findings as kind of the ultimate experiment in trying to find out if neighborhoods really matter. And these maps certainly suggest that they do. And so then there was a MTO redux effort that went back, and Larry Katz and Nathan Hendren and Raj Chetty published a paper where they looked at the MTO findings, and they looked at kids that had moved when they were young and had stayed in those neighborhoods. And sure enough, they showed a lot of the same effects that you see that you would predict based on the map that I'm showing you here. People that moved to opportunity neighborhoods and lived there, the longer they lived in those neighborhoods, the better they were doing as adults as measured on these outcomes. And so that was tremendously interesting and helped us realize the importance of neighborhood, and was like this broad research interest. But that was also quite interesting to practitioners. Maybe, Sarah, do you want to talk about the reaction in your world to that kind of stuff?
Yes, I will talk about the reaction in our world. And Christopher and I are going to go back and forth a little bit because we thought the best way to present this team effort was by a team effort. So when that research came out in the Times, I think that in some ways it sort of validated some of the neighborhood variations that practitioners, certainly in Seattle and King County, had been noting for some time, but it gave, I think, much more rigorous, much more big data evidence that the variations that we were seeing across our community were in fact real. It also, I think, really emphasized the importance of place, and so it helped us to, I think, it added new momentum to efforts that we had been trying to put in place for over a decade prior to this research coming out around how do we really support opportunity growth through our place-based initiatives, and how do we also enhance geographic choice among our voucher holders in particular, as well as through our efforts in where we develop and site acquisitions. So when those two pieces came out in the Times, I think we're going to talk a little bit about how this all came to be. So when those pieces came out in the Times, the then executive director at the Cambridge Housing Authority, who was just down the street from Harvard, really cold called Raj and said, we've seen these pieces. This has enormous relevance for where the housing authorities are trying to really think critically about what strategies we might undertake and what are the empirical underpinnings to this. Would you be interested in having a conversation? And I think to the housing authority's great delight and somewhat surprise, Raj said, sure, that would be really interesting. We're trying to think sort of what's next in this research portfolio. And so from there, this was about 4 years ago now, we had our first convening around the sort of national CMTO project, which was an opportunity for housing authority leadership from across the country to come together with academics, including Christopher and others, and really dive deeper into what the research meant and what some of the persistent questions were from it. And I think also for the academics to get a better sense of how does this really apply to the on-the-ground experiences and barriers that housing authorities, and more importantly, the residents and the landlords that we're working with, that they're serving. And so from there, this really took a very organic trajectory. We had that first convening that led to subsequent conversations, most importantly, pulling in Seattle and King County, the Bill and Melinda Gates Foundation. This dovetailed with where they were wanting to go, really looking at what were some strategies to increase kids' long-term educational outcomes. And so although Seattle and King County is the first of sort of the local proof points across the country, we're hoping that this will be, CMTO is national in effect. So Seattle and King County, because the Gates Foundation was there, was the first of these proof points. And I'm going to go on to sort of talk about what the project has been about. How do I advance here? So the project goal is really to develop and test strategies which will effectively support opportunity moves and geographic choice among families with young children who are using a housing choice voucher. I think some things to really point out on where this project differs in important ways and also builds on what we've learned from MTO, what we've learned out of Baltimore and Dallas and Chicago, the sites that Lawrence talked about last night, is that we really wanted to see what were the strategies that could best mitigate barriers that families were experiencing and having true geographic choice once they received their voucher? There's not a requirement that families use those vouchers in certain neighborhoods, and that element of choice is very different in this experiment than what we've seen in prior experiments. The project has really rolled out in terms of 4 phases, and so those early convenings gave rise to the first phase of this project, which was really about development and pilot testing. We spent a full year working in collaboration with the academic team, MDRC, and others to really identify what is the intervention that would make most sense in the very tight housing market that we're working in Seattle and King County. And that involved, obviously, first, learning from folks who have been doing incredible mobility program prior to this, so in about Baltimore, in Dallas, in Chicago, trying to suss out what were those key elements that were most successful there, which of those elements would be most appropriate in the kind of housing market that we were working in. And then doing a lot of conversations and informative interviews with landlords, with current residents, with incoming residents, and with frontline staff to really understand what were the barriers that folks were experiencing. We wanted to make sure that we spent ample time building out the intervention. And I think that was really important from the practice side of this, because so often we see the results at the tail end of things, and there's not necessarily an articulation of what was done to get to those results. And being able to have sort of the thought and the clarification of what was going into that black box of intervention made this all the more applicable. We then moved into phase one, and Chris is going to talk a little bit about the results that we're seeing from phase one. That was a full year of the first randomization of this experiment. We decided to do a sequenced approach in this, where phase one would be sort of an all-in suite of tools and strategies. We would see what effects we saw from that. And then we would move into phase two, which would help us to suss out some of those individual strategies and would give us some insights into not just what works when we think of things in a super comprehensive way, but also if we pare things down, are there impacts that still persist and might be employed in more efficient ways. And I think coming up with that scaled strategy was also really meaningful from the practice side of things, because so often we look at interventions and it's everything, and we don't then see what are the most cost-effective, most efficient ways of going about applying those interventions that may have bigger implications from a scale and a sustainability standpoint. So that's sort of the broad phase of each of the intervention. I think we can think of each phase as taking about a year, and so this has definitely been a long game effort. Although I think that there is certainly interim learnings that we're learning along the way, and we'll talk about at the end. And then at the bottom there, this just is a reflection of all the folks who have been involved in this effort. So as Christopher mentioned, this has been a collaboration between both the King County and the Seattle Housing Authorities, JPAL and MDRC, who have been really instrumental in terms of building out those randomization models, as well as the implementation research. And then a group of interdisciplinary researchers through Opportunity Insights and other academic institutions, and a nonprofit who actually has been providing the services through CMTO. So for phase one, which we'll talk about, the sample frame for families who have been involved in this effort is that this was offered to all families who were coming to the top of our Housing Choice Voucher waitlist and had at least one child who was younger than 15. These were families who had already been on the existing Housing Choice Voucher waitlist for either Seattle or King County Housing Authority, and these were families who were enrolled between April of 2018 and April of 2019. This included just over 400 families who were then randomly assigned to either a services as usual group, which included still receiving the voucher, or a treatment group, which included using your voucher, as well as having access to a variety of augment support services. I also want to note, given the presentation before and the sort of low opt-in rate that may have been observed in MTO, in this case we've seen like a 93% opt-in rate, and this is partly because these were families who the standard services is going to be receiving their voucher as planned anyway. And what we're offering in the treatment group is just additional services on top of that. So these are the elements in the intervention. You can review these in your own time. As I mentioned before, these are the result of sort of this this year-long formative conversations. But the intervention elements consist of customized search assistance. So voucher holders, when they come to the top of the list, are offered services if they're assigned to the treatment group to access high opportunity area education. So working with navigators to understand which neighborhoods might they be interested in, what are the amenities in those neighborhoods, really sort of hoping to provide some of that information that may be lacking when voucher holders receive their voucher and don't necessarily know where they can use it. Rental application coaching, so helping voucher holders to be as competitive in the market as possible, and then direct housing locator services, so direct referrals to units, as well as accompanying families out into their housing search experience. In addition to that, we've been working on landlord engagement, so making sure that navigators are going out and talking about the program and bringing landlords into the program who have holdings in high opportunity areas, and then financial assistance, which we think is really important to level the playing field because some of the costs in accessing housing in these opportunity areas are quite high.
Let me also say that it was not at all obvious that this is where we would end up with this suite of services. That it was not like an off-the-shelf, oh, quite clearly we want to test exactly this program. We had to figure out how that was going to work, and that's what a lot of the upfront time was. And Sarah mentioned two things that I'll reiterate and stress, and one of them is that we were trying to stand on the shoulders of people who had done programs that seemed like they were successful elsewhere. And so we did a lot of listening, and we had a lot of convenings, and we would try to get some of the people that had been the most successful in the same room, and we could talk through various things. And then those were things that had worked or not worked or seemed like they had worked in other geographies. And so then we had to think about what was going to be important in Seattle. And actually, we did have a lot of stakeholders that we were talking to. And we did talk to tenants and people that had made the move. And we talked to landlords and the frontline staff that were not necessarily at the national convening of PHA leaders to talk about this, had a lot of insights, and getting their buy-in was invaluable for the success of the rest of the project, but also getting their insights and their wisdom was invaluable for being able to design exactly what was going to work in Seattle. Some of these things, like the idea of a rental broker that goes around and helps you find an apartment and collects a commission for that, is very common in some cities and unheard of in other cities. And so there was a little bit of an element of, well, we have to find a nonprofit that has done something or that's willing to learn how to do something that has never really been done before. And so that process took a lot of time up front, but it felt like it was very valuable time well spent to kind of get to the place where we felt like we had this broad spectrum antibiotic that we could release and see how effective it was. One of the design elements that we had to do was to think about what classified as an opportunity neighborhood. And so we have lots of shades of red and blue in that map that I showed you for Seattle. And to make things operational, we had to come up with like a way to classify what we were going to target as an opportunity neighborhood. This also was just kind of a microcosm of that design phase and the back and forth that had to happen. And I was encouraged by how much it wasn't just, these are the neighborhoods we think are opportunity neighborhoods, we the academics or we the practitioners, but there was a lot of back and forth. There were some neighborhoods where you could be fooled by your impression that a neighborhood that has a lot of luxury apartment towers must be a great place to grow up, but when you dig into the data, that's actually not a great place necessarily for a low-income family to grow up in downtown Seattle. And there were other places that maybe looked great in the data, and we needed to appreciate that there were some practical considerations for why that wouldn't necessarily be the ideal place to classify as an opportunity neighborhood. So this is the map of what it looked like, and those services that we explained. You could use your voucher if you were in the treatment group in any neighborhood you want, but there were some services that you would receive that were especially to encourage you or to really remove any barriers that you might face in moving to one of those places.
Yeah, I think, and I would just add on the maps creation, I think that this really was instrumental in terms of solidifying the partnership. I think that one of the most impactful things that the academic team said after we had seen the preliminary maps was that these were based on big data, and that's just a starting point. It's not the end of the conversation, right? So the academic team came out. We did tours of neighborhoods, we did a lot of listening sessions, and we figured out ways to incorporate additional information into those maps to account for some of the concerns that were coming up from the Housing Authority around how well did these maps reflect neighborhood transition, how could we think about ways to build out the maps that would actually be operationally feasible in terms of contiguous areas, as well as building it out as a binary measure as opposed to sort of that multicolored map that was shown at the outset.
And we'll hit on this in the conclusion as well, but looking at it in hindsight, I just think about how doomed it would have been if the model had been we in the ivory tower write down exactly how things are supposed to be, and then we like send it by carrier pigeon to Seattle, and they just have to like take those instructions as given. I think at every stage, the back and forth, I think, had a lot of learnings for both sides and was extremely valuable. So let me show you some of the results. So we have our phase 1 results in hand at this point. And so to kind of set the stage, when you do any kind of randomization, you're trying to think about what kind of a sample size do we need. And when you work with observational data, you get to use the hundreds of thousands of people that are in the census, for example. And we were thinking, well, this is not going to be free for us to do this. We are providing some extra services, and we did have to fundraise for this. And there are natural constraints that the public housing authorities face in terms of the number of vouchers that they can issue in a given year. So I was tasked with doing a lot of the power calculations, and I was looking at the fact that in the Seattle and King County area, families that are using vouchers, historically around 11-12% of them have moved to what we were classifying as an opportunity neighborhood. And so as I was looking at the power calculations and trying to figure out, what could we hope to achieve, we settled on a sample size of around 400 for that phase 1. And I thought, well, hopefully we can bump it up to say 15% or say 20% of people, from 11%, 12% as a baseline up to 20%. If we could get there, I think we could detect it and we could have statistical significance. And there were a lot of questions back and forth trying to iterate on that, and we certainly weren't in a position to say, okay, we need 1,000 people, so let's make it happen. We needed to figure out, what compromises could we make. So that was the historical mean, and I animated this a little bit to be a little bit more suspenseful. So the control group ended up coming in at around 14%. And so again, my hope was that we were going to be able to get to 20%. And frankly, we were blown away when the treatment group, since they weren't required to move to an opportunity neighborhood, when more than half of them were choosing to move to an opportunity neighborhood. This is a massive effect from my career in social sciences and that of my co-authors, and we were very buoyed up by this. And let me mention a couple other things about our findings and kind of dig into them a little bit more. So it wasn't the case that everyone was moving to the closest place that was right over the line where they could get help with their security deposit or where they could get extra help with their rental applications. People were moving quite broadly across the metropolitan area, and that gave us a lot of encouragement that what we were really finding were that we were unlocking choice. It was that people would normally, if they didn't face all of the constraints that they face, choose a lot of different places to live, including a high prevalence in opportunity neighborhoods, given some of the benefits that we've documented in living in those neighborhoods. And sure enough, when we've taken away those barriers, we do see a large fraction of people choosing to move all over the Seattle area, and a high fraction of them being in opportunity areas. So as a finding, that helped us think that what we've really done is been able to find I would say straightforward set of interventions, not that they were straightforward to develop. There was a lot of care and thought and work that went into them, but a suite of resources that did unlock choice and lead to a much higher fraction of people moving to opportunity. So if we roll forward and kind of predict what would happen if these people were to stay in these neighborhoods, based on the effects we've estimated in the past about the causal effect of living in these neighborhoods, they would have a 10% increase in their lifetime income. So for this particular demographic, that would be an extra $200,000 over the course of their lifetime. Some of the other outcomes would also be quite positive in terms of lower incarceration rates for the kids that grew up in these areas, lower teen birth rates, and higher college attendance rates. So that gives us this immediate tool to reduce segregation. And when we think about, is it feasible to move everybody out of Appalachia? Well, we're already spending money. $40 billion was the number that Sandy cited on affordable housing policies in the United States. This is money already spent. This is an intervention that we can lay on top of that and unlock choice and have tremendous effects on expanding economic opportunity. There's a couple key things that I want to mention. So one is that a key follow-up is going to be how persistent are these moves? So we've seen that they've moved there, but do they stay there? And that's actually one measure of satisfaction, if you will. So for the effects of the neighborhood to kick in, prior research suggests that they need to live there for a while. You need to grow up in these neighborhoods, not just be there for 6 months. But also, if people are not persisting, it suggests that despite the fact that we're measuring that there are great benefits for these neighborhoods, there are other reasons why they don't prefer to live there. So we'll see after a while how long people are staying there, but in the meantime, we can ask about satisfaction. So we've done a lot of qualitative research, and by the way, that's been incredibly rewarding to see how people are viewing these moves, and the results that we've gotten so far has been very heartwarming to see how satisfied they are, and also to see the kinds of things that they're citing that was so helpful for them. And actually the number one thing, which you won't see in very many economic models, was that the treatment group families that moved cited the emotional support provided by the staff and the personalization and the customization of that help. So with one family, the right thing to do is to just flood them with listings, and they just need lots of listings. And with another family, there are other problems that you're going to want to triage and help talk them through and help give them hope. And so that kind of customization was actually quite important, and that was a key thing that we have looked at so far and will continue to look at.
I think I'm going to just sort of fly through these. I mentioned that phase 2 is going to help us to isolate, how do sort of these comprehensive supports compare to financial incentives alone or to lighter touch service models, and that will be really important, something that housing authorities are keeping a close eye on. So stay tuned for that. And I mentioned already that part of this research is the hope that we can demonstrate what might work in housing markets like Seattle and King County, but also look at how these strategies then apply in other housing markets across the country. And Sandy mentioned the mobility demonstration already, and I think there's great optimism that additional resources that are going into that will help us to get even greater research and understanding of what strategies work most broadly. It's exciting to see sort of this policy shift happening. But one of the things that we were directed on was to be reflective. And so, Christopher, what would you say are your biggest lessons learned from this?
So one thing I promised I would reiterate is just how back and forth and how kind of important the feedback loop was between the boots on the ground practitioners and the academic team. I felt like there was a great synergy between having research along with practice. So first of all, that made the research much more relevant and impactful right away. It I think, provided us with a degree of credibility that what we were testing was actually passing the gold standard of randomization. It was useful from a fundraising perspective, that it wasn't just us fundraising to kind of write a model that would give us some theoretical predictions, but that it was something that we were actually going to learn with real people. It was also incredibly rewarding to be able to, through the qualitative research and actually through just the listening and the preparation and the development phase, to realize the individual stories that were coming out of here, and to for the people that I was able to meet myself, but also the transcripts that I was able to read of some of the interviews was really rewarding. So that was a lesson, is how collaborative this was, and how it took many years, like we've talked about, and is still ongoing, but how worth it that was. That was a key lesson for me.
Yeah, I think from my vantage point, I think all of those things. I think it was also really important to identify at the outset what were the research questions that both groups had, and to really identify where was their alignment between that. I think one of the things that the academic team really built in and listened to the housing authorities on is that there was not necessarily an appetite from the housing authorities to participate in an RCT and then have to wait 3 or 5 or 10 years to get anything meaningful out of this. And so what were the incremental lessons that could be learned along the way that would have very real impact? And so I think, one of the great benefits is that, throughout phase 1, this really allowed the housing authority, in concert with the academic team, to sort of look under the hood of the services that we're providing and identify places that we can make incremental adjustments to those services that will be of benefit to everyone, and we think that will greatly benefit sort of the choice set that people understand when they receive this. So I think being able to have those incremental learnings along the way, and then have these sort of tight benchmarks around looking at locational outcomes as well as the long game, was really critical towards there being sort of buy-in, in a sense that this was jointly owned and honored. I think also the fact that this was interdisciplinary research, and it had both qualitative and quantitative components, and there was obviously a strong economics focus, but also we had sociologists at the table, and I think that really helped because it was already multidisciplinary in terms of perspective, and then we pulled in all these other perspectives from the housing authorities. I think that was really sort of beneficial in feeling like we had a richer product that came out of this.
I'm not sure I would necessarily call this a challenge, more as like something that was really important that we realized, but that buy-in was not a foregone conclusion. So you're choosing to be in this particular room with this particular agenda, which is not to say, so that I would predict that many of you would be open to research around opportunity and to something like randomization, which is not to say that every one of your colleagues would raise their hands to say, yeah, this is exactly the direction that we should use our scarce resources and time to go. And this is exactly where we should go. So there was certainly, that was important to invest heavily in upfront and to have face time and to figure out what the concerns were. And there were staff, for example, that were saying, well, I'm more worried about people using their voucher than I am about where they move. And that's a very legitimate perspective that we wanted to understand and validate and learn from and incorporate. And I think that doing that upfront led to greater kind of... I would say we had to have buy-in from every level. So the frontline staff clearly had to have buy-in, but also one of the reasons Seattle worked was that we had a lot of equity ownership and investment in the project from the leadership, from the board of the public housing authorities, from policy folks, and that like all up and down the staff. We just had a lot of buy-in, and then obviously the researchers were on board, and then we were able to bring funders to the table. This wasn't cheap, so one challenge was finding people that would be willing to fund this RCT, and that was one of the synergies we had with the Gates Foundation, that they were a good partner on the resources side as a constraint. So we worked to find that funding, and then we also had to work within the constraints of what the public housing authorities could do in terms of the vouchers that they could issue and how they could operate vis-a-vis their wait lists.
Yeah, I think like that alignment and that sort of understanding of what were the operational processes and what were the research processes and where would those meet, and being able to make adjustments and frankly some compromises so that this would actually be feasible was something that was very much a part of the design process. I think the last sort of learning from the sort of practice side of things is that I think that there was a notion that an RCT would really bind us. It would hem us in from being able to make incremental changes or innovate along the way. And I think that was leading to a lot of the hesitancy. And I think that we found that by having this very close sort of dynamic relationship with the academic team, as new things came up, as sort of incremental policies were happening in the community, or there was an initiative that needed to be tested, there was actually space to be more nimble despite being within the sort of contours of this RCT framework than I think we had initially assumed, that we could continue to make changes along the way and still see robust results. And so but I think that came about because there was sort of a shared understanding of the baseline that we were both functioning from, and we could make those decisions together.
Great. Well, thank you for a great presentation. We will now have Keely presenting.
Good morning, everybody. My name is Key. I'm from Santa Clara County, Silicon Valley. It's about 1,300 square miles, 15 cities and towns, from Palo Alto, where Stanford University is, which is actually in the unincorporated area, all the way down to Gilroy, which is a sort of a small farming town. I like to come to these because I love talking about what we're doing in Santa Clara County. I think it's a lot of good practices and new practices, and happy to share that. Second is we like to say that we're open for business. We're doing new things, and we like to sort of study those and evaluate those. But I will say this is like my 4th or 5th gathering with researchers and practitioners, and it's mostly a bummer because it's like, yes, the research is saying that things are bad and getting worse, and probably nothing you can do is sort of going to shift that trend. And your programs are probably not having the impact that you think they are, or maybe the sort of conflicting research about that. But as my dad used to say to me, idiot, just get over it. So here we go. Okay, so where I live is, I work for the county of Santa Clara, and the Office of Supportive Housing basically is that entity that is sort of at the end of the line. That is when people are at the end of their line, we're sort of there to try to sort of lift them up. This Silicon Valley, a lot of prosperity, great weather, but the housing production system, the safety net system, doesn't necessarily work for everyone. Our office does basically three things: implement permanent and temporary housing programs for homeless individuals and families; two, coordinate all of that countywide; and three, implement sort of housing development strategies to sort of overcome, to reduce homelessness and sort of prevent homelessness. The county has not always played a big role in supportive housing, but it has over the last few years. And since 2015, which I call the sort of the modern era of the supportive housing system in Santa Clara County, we've had some successes here. And as you can see, we're funding housing development, implementing housing programs, and temporary shelter programs as well. So all of that is great. In California, counties are the administrators of the safety net programs, child welfare programs, especially mental health services for poor people who have the serious mental illness, things like that. So when the county implemented our housing bond, a general obligation bond, which allows us to provide $950 million towards housing development, we focused most of those funds, $700 million of those funds, towards extremely low-income households. So households earning 30% or less of area median income. Someone who is disabled in California is getting about $900 a month, so they're like at 12% of area median income. There's no sort of market for that. There's no sort of market solution for all of that. So we, as the safety net, and because our safety net population really needs affordable housing, we implemented this housing bond. And here in this chart, you can see sort of where we're at so far. We have about 19 projects underway, and the chart shows what is that resulting in terms of different types of housing units. The rapid rehousing units and permanent supportive housing units there on the right-hand side, those are what we call our supportive housing programs, and we'll talk more about the rapid rehousing programs specifically. I like to show this because these are nice pictures, these are nice buildings. There's two new developments, one in Sunnyvale, the one on the right's in San Jose. Again, this is housing, local housing subsidies going towards the development, project-based vouchers from the local housing authority to provide the operating subsidies, and a commitment by the county, the safety net system, to fund all the supportive services in the supportive housing units associated with these two developments. And these two developments were implemented prior to our housing bond. Our first housing bond funded development is in the city of Cupertino. It's called the Veranda. You may know Cupertino. That's the headquarters of Apple. The spaceship landed, and that's where their new headquarters is going to be. So I bring this up for a couple reasons. One is great. Hey, we got our housing bond funded funds being implemented. Two, you can see here that although this is only 19 units, a third of the units are permanent supportive housing, a third are for extremely low-income households, and the rest are income restricted. So that is because we, the county, require that proportion at least in every development. Or else we're not going to build the affordable housing to the levels that we need. And I also bring this up because this is Cupertino. They haven't built any affordable housing for 10 years, and we got 19 units, so that's not great. But we're trying to change that. So how do we get into the sort of research partnership business? I think it all began really with our homeless cost study, which was published in 2015. Our friends at the Economic Roundtable helped us gather up all of the county administrative data. We looked at 104,000 records to look at really how are homeless individuals and families utilizing the public safety net system. And from there, we realized, hey, we have information that can be helpful to us and to other people. Charities Housing, which is a local sort of affiliate of Catholic Charities in Santa Clara County, introduced us to Leo. And initially they wanted to study the impact of waitlists and affordable housing waitlists. We weren't able to get that going, but from there, we were able to sort of launch a partnership in two projects that we're going to talk about today. So before we talk about that, I sort of have to just give you a little bit of context about our supportive housing system. So like most communities that implement a supportive housing program using HUD funds, we have a coordinated assessment system, a coordinated entry system, which simply means that county-wide, we have a sort of systematic way of assessing individuals and families based on for their housing need. And we have a way to prioritize those families and sort of refer them to programs. And what you see in this chart is basically that we assess individuals and they sort of fall into 3 categories. The first is permanent supportive housing. They need permanent supportive housing. Usually these are individuals with disabling conditions. They need deep, ongoing permanent subsidies with ongoing services. The second category, which we call rapid rehousing, sometimes called transition in place, are individuals and families who have the ability mostly to have earned income, so they sort of need temporary subsidies, temporary services, and then the third category is you need sort of like one-time interventions to help them resolve their homelessness. So typically what we've seen since 2015 or late 2015 when we implemented this is that about a third of the individuals coming in for assessments need permanent supportive housing and about half need rapid rehousing. The other thing to mention here is that the PSH, the individuals who need PSH or rapid rehousing, they really fall within a range, a score. So rapid rehousing, the score, the vulnerability score is 4 to 7. And then so we're prioritizing individuals at the highest need level first. Same thing with permanent supportive housing, sort of a score range from 8 plus. We're sort of working our way down from like 16, 15, et cetera. In addition to what we're going to talk about today, we do have 2 other sort of research projects going. One is for our permanent supportive housing program. UCSF is doing an RCT there. We have about 14 capacity to serve about 1,400 households in permanent supportive housing programs, not including HUD-VASH. And a small subset, a small program within that uses a social impact financing, and we're doing an RCT there, not to try to prove that permanent supportive housing works for the individuals, but really just to understand more about that programming, what is sort of the level of intervention required, what are the costs associated with that. And on the right, we implemented a new homelessness prevention system. This is people who are housed but are sort of at risk of homelessness. They're calling up and asking for assistance, one time or short term. In the past, it was sort of Wild West. You know, you call an agency if they had money that month, you got some assistance. We never knew who should get assistance, what happened if they didn't get assistance, did the assistance really work, was the amount of assistance necessary. So we have a homelessness prevention system pilot underway, which Leo is also a part of, and then we have this rapid rehousing RCT that David's going to talk more about. So why are we doing this? One is because we have a big problem still, and according to the University of My Eyeballs, more people are needing help than sort of are being placed into housing. This is according to our homeless management information system. For every 1 person we house, somewhere between 2.5 to 3 individuals are coming in and sort of saying that they're homeless for the first time. The picture is also pretty bleak on the homelessness prevention side. For every 1 person we assist, many more are calling in for assistance. And of course, through the research project, we'll try to determine, you know, of the people needing assistance, how many really needed that assistance. And so what are the goals for this partnership with Leo on the rapid rehousing programs? First is we just want to be able to try to improve our rapid rehousing programs. I don't think there's a lot of research or evaluation associated with these temporary assistance programs in general. Second is we need to understand you know, is our coordinated assessment system effective? Is it identifying people at the right level of need? You know, I said earlier that usually in rapid rehousing programs, these are individuals or families who have the ability to have earned income. So you give them temporary assistance, and they're sort of moving on. But we're finding a lot of older adults on fixed incomes, even individuals who have disabling conditions, are actually falling into the rapid rehousing range. So, you know, what does that mean? Does that mean really they only need that type of assistance, or really should they be in the permanent supportive housing range and we're just sort of not getting the right information? Third is, I think if you live in the supportive housing world, you know there's a lot of energy and empathy for certain populations: homeless veterans, families with kids, young adults coming out of the child welfare system, maybe even chronically homeless disabled persons, because there's a sort of cost argument, there's a sort of like a social contract argument, but single men and women, mostly men, who may have substance use issues or mental illness, just not a lot of empathy or not a lot of talk about those populations. And that group by far, that population sort of far outstrips sort of the other populations, both in terms of size and sort of the resources allocated to that, right? I'll say lastly, on sort of advice for others, so I'll echo some of the points that Sarah and Chris made. It's really hard to bring practitioners and make them work well with researchers because they sort of come from different worlds. So there's just a lot of time and energy needed to bring folks together. Two is just because I contract with these agencies and pay them, they don't necessarily listen to us, or they have the ideas of their own. So we have to work through all of that. And just because a county government is pretty hierarchical, doesn't mean everyone does what the county executive tells them to do either. So you got to spend a lot of time working with individuals, convincing them, cajoling them, bringing them on board. Second is bring in your attorneys early. We have a very good set of county council attorneys in the county council's office who basically work through issues to help us get access to all of the administrative data. Three, be open. When I sort of first envisioned this project, I said, look, rapid rehousing programs are about volume, right? I have the capacity to serve this many people at a given time. If those people get off assistance, I can serve more people. So I'm like, well, why don't we stop serving the people at the highest range? Why don't we start serving everyone at the lowest range? Maybe we can get more volume, right? Volume. But I think for research purposes, I think we modified that, and I think it'll be fine. Okay, and then finally, I feel like Leo, Economic Roundtable, other folks, I feel like they're our friends. It takes a long time to build relationships, and it's good to work with organizations that you feel are sort of mission aligned, and I think that's critical. That's it for me.
Great. Thank you, Key. We'll have David Phillips from LEO.
Thank you. And thank you so much, Key. And let's see, not quite there yet. Yeah, so as Anusha said, my name is David Phillips. I'm at the Lab for Economic Opportunities, or LEO, at the University of Notre Dame, and it's been exciting to partner with Santa Clara County on a couple of projects. Really, I'll talk mostly about one that Key mentioned about evaluating the effectiveness of rapid rehousing for single individuals in Santa Clara County. And I'm going to focus a lot on, this is a project that's in process, so a little bit different from some of the work in King County, right? I'm not going to show you results from this today. I'm going to focus a lot on the process of building this partnership and some of the challenges and some of the benefits and exciting things along the way that we're in the middle of right now. Just to introduce a little bit of who I am, where I'm coming from. So I'm at Notre Dame. I'm at the Lab for Economic Opportunities. We've been doing this type of research partnerships for about 7 years, and a couple of projects that we have at Santa Clara are two of 42 projects that we have together. With lots of different partners around the country. And so that's why I'm really excited to talk about research collaborations today. And the goal of all of those partnerships are to reduce poverty through producing evidence, which is kind of a big, ambitious, audacious goal, right? To say we're going to make an actual real difference in the lives of real people through creating information, right? That's kind of a long vision goal, but we are being sort of audacious about that and saying that that's really actually what we want to do. We want to do work that's actually going to make a difference. And yeah, I wanted to do this one first. So what do we do? Why do we do that? We think that we can actually have a difference in improving lives. Why is that? I think there's a couple of reasons, which have been alluded to a little bit already in this session, right? Part of it is from the researcher point of view. Like, I gain a lot from a research partnership, right? There's a lot that I don't know. Within researcher communities, I could be viewed as an expert on homelessness programs. That's not actually the case, right? I'm an expert on doing research. And because of our partners, folks like Key and the folks who work with the county and at the nonprofit organizations they contract with, right? I'm able to surround myself and interact with people who are real experts in that programming and learn from them about the questions I should be asking. And I think on the other hand, right, as researchers, we have some expertise in terms of evaluation and research and working with data that we can offer to partners and help them leverage that to answer questions that they have and to be able to use that information to help guide how best to do the work that they do. And so we believe that by matching together academic researchers, service providers, policymakers together in these sort of research collaborations, that we can actually make a difference. So what about this particular project? So what does this one look at? And again, I'm going to focus a lot on process rather than outcomes here, just for the purpose of the conversation about building these partnerships. So what were our goals going in? Key talked a little bit about Santa Clara County's goals. What were our goals as a research organization going into this? I think we start with a research question. So here there were two, and this echoes some of what Key said, right? Is we want to know how much and does rapid rehousing improve outcomes for homeless single adults, right? There is this question about temporary subsidies, right? Rapid rehousing is providing a few months of a temporary subsidy, some help in identifying a unit and getting leased up, and some case management services around that. How effective is that? We have a lot of evidence that more intensive interventions like permanent supportive housing can make a huge difference in terms of people's housing stability. The evidence on rapid rehousing is a little bit more mixed, and there's a lot more to learn, I think, there. And so we're excited about that question. And we're also excited about the for whom does this work best question. As Key mentioned, right, there's this coordinated entry structure in counties across the country, or groups of counties, that is trying to triage people between different options of homelessness services. And this question of who do I send to which service is a really big question that we're hoping to get a little bit of purchase on here. We ask those questions because the sort of test that I try to have, and I think we as an organization try to have for any of these research projects, is that it's going to have both a local impact and a broader impact. If the answer to one question or the other of those is no, we're not going to have an impact locally, or we're not going to have an impact in a broad sense, then doing something like ambitious randomized controlled trial probably doesn't make sense. You have to be able to answer yes to both of those questions. And so I think here, right, there's this, as Key framed, right, there's this local impact question of what's the most effective response to these incredible changes in the number of people who are homeless, in particular unsheltered homelessness, and thinking about the best way to do that locally. There are real questions about that in Santa Clara County. There's real ways that Key and his group have use for additional information. And there's also real questions nationally about how best to do homelessness services, right? There is this question about, so housing first is this idea that's maybe familiar to many of you, but not others, the idea of shifting from some more traditional homelessness services programs to ones that focus on providing housing first, and then making support services optional, available but optional, and focusing on sort of housing as a platform for future growth. And there's a lot of evidence that the intensive version of those interventions, the permanent ones, have big effects. But there's this question within the housing first community where people debate a lot, and you see homelessness advocates on either side arguing, should we be going toward generous subsidies, permanent subsidies, like permanent vouchers with support services wrapped around it, because those are the things that are going to be more effective? Or should we try to, because most people actually aren't being served by those, there's a huge shortage in Section 8 vouchers. Many of you are familiar with long and closed voucher wait lists and all of this. Should we move to a system where more people are served by less generous vouchers? Right? This is a huge housing policy question, and so it's something that we can speak to. We can go in Santa Clara County, a place where the housing market is difficult, where these resources are very scarce, and ask, could we effectively serve people with these shorter duration subsidies? Could you see the same effects from them in that context? And so there's a broader question as well. So what does this evaluation look like? So it is similar to the CMTO work. It's a randomized controlled trial. So it's going to be trying to measure a question about impact, right? When somebody gets rapid rehousing services, what happens to them in terms of homelessness, entering an emergency shelter, and other outcomes, healthcare, contact with the criminal justice system, et cetera. And how does that look, not just for those people, but how does it look relative to what it would have been if they didn't have access to this? If we didn't do rapid rehousing, if we did the usual thing, what would their outcomes look like? That's the question that we're trying to answer. And so doing that involves a process. And so I want to dig a little bit into the process of what this looks like, to try to pull out your questions about, well, how do you deal with, there's a lot of tough stuff in this process. How do you deal with it? So the way the process works, so if for a single individual in Santa Clara County who's homeless, what happens for them when they show up to this study? So what happens is there's the coordinated entry system in Santa Clara County. It's going to generate a list of thousands upon thousands of people who have at some point in time come in contact with that system and are eligible for rapid rehousing. For a program, this singles program is going to have about 90 slots of people at a time in it. So there's a huge number of people who could be eligible to this. And so there's going to be groups of them at a time that are going to be referred by the county to the nonprofit partner, Home First, who's going to go and identify folks. I feel bad that I didn't put this on the chart because that really should be the first step, is going and finding people. And the folks at Home First would tell you that's a big part of their challenge is identifying folks who are often unsheltered homeless and not straightforward to find. So when they are able to find folks, they explain to them what's going on. There's this trial program in the county. There hasn't been rapid rehousing for singles before. We're doing this right now, and there's an evaluation that goes alongside it. Are you interested in that combination of things? And if they are, then they're enrolled in the study. First, they check eligibility to make sure the person fits, that they're single, they're in the right score range of this risk tool, and so on. And they can collect some very limited baseline information about that person so that we can find their outcomes later on in time. And then there is a random drawing. So this is a randomized control trial. So for every 2 people that come into the evaluation, right, one's going to be getting rapid rehousing, and one is going to be getting usual care. So there's going to be a random drawing, equal chance of getting those 2 different options. And usual care is going to involve referral to a bunch of different existing services that are there, but are going to be less intense than rapid rehousing. And yeah, we'll talk about challenges in that in a moment. And then, depending on what group the person is assigned to, they're going to be either enrolled in rapid rehousing or they're going to be referred to those other services. One nice thing from this evaluation that we were able to set up, and is similar to many evaluations like this, is that the person doesn't have to worry about, the client doesn't have to worry about the evaluation from that point on, because we've collected enough information when the person comes in the door that we can link to other existing administrative data that the county has. So like information on shelter entry records. We can say, hey, we can look up and say, hey, did this person end up in the shelter, and be able to measure that outcome. And importantly, we can see that for both groups, right? So we can say, for the person who gets rapid rehousing, we can't see it yet. We're in the middle of the process. But we eventually will be able to say, for the person who gets rapid rehousing, how do they look different? Do they look different in terms of their likelihood of entering shelter? And all of these other outcomes. So what were some challenges in this? So I believe the way that Jenny and Abby pitched this session to us was, okay, convince people that doing evaluations is hard but not impossible. So this is the part where I'm going to tell you that it's hard. This is a very ambitious project in terms of timeline. I'm going to be upfront about that, and that's one thing to think through here. So this is what the timeline the top is what the original planned timeline was. The bottom is the actual timeline for this, and it's a long timeline for this project. Right, as I mentioned, there's 90 people in this program at a time. Quantitative studies like this require a relatively large number of people involved in them, and so enrollment for this program is going to go on with the study for 3 years to enroll it, because the flow of people in is relatively slow. So that's a reality of this study that's not true of a lot of other ones, but is true of this one. So because of this, we met, I think, about in October 2016 or so. To make this graph, I had to go back in my emails. I was like, when did we first meet? I think it was about October 2016. We had a year of plan. The plan was to have a year of planning, begin enrollment a year later, do 3 years of enrollment, and then after end of enrollment, October 2020, right, you have to wait a couple of years for people's lives to happen, right? One of the most important questions is what happens to people when the subsidy shuts off? So you need to wait long enough to see what happens with that. So there's also some length built into the study for that. And so the plan was for this to, have a final report in October 2022, right? So that's a long-term project. Not all of ours are quite that long, but that's one of the challenges of this project. And in actuality, it's been pushed back by about a year because of challenges up front in doing some of the contracting and such that needed to be done up front. So now we ended up getting pushed back about a year behind schedule, but now, thankfully, since enrollment started, things are sort of humming along well. What are some challenges that we ran into along the way that are worth talking about? One are compliance issues, right? So we're talking about getting people's permission up front to access lots of information that the county has about them, entering emergency shelters, using publicly funded healthcare, et cetera, right? That's really challenging data to access, right? And there's a lot of legal wrangling going on in the background. That key, right, his advice of getting the lawyers involved early, I think is one of the things that we learned from this one, is that we would have done that earlier in the process, and that's one thing that delayed us. And so thinking about data sharing, ethical review, both of the privacy side and the doing a random drawing side was an important challenge in this one. I mean, doing a random drawing in almost any context is going to raise some ethical and practical concerns about how to do that in a responsible way. Two things I would say about that, if you're thinking about doing a project like this. One is you want to operate this type of design only makes sense when you're operating in a context of excess demand, right? And what I mean by that is there are thousands of people that the county knows are good fits for this program, and they have 90 slots. And so in that context, doing a random draw is a fair way to allocate something that's scarce. If that were not the case, then you and I and lots of other people will have a lot more problems, I think, with this design. It's not, there's still other pieces of it that you have to think about carefully, but that helps a lot. And the second part is to think about what the quote-unquote comparison group is getting, right? It's not placebo sugar pill. It's not nothing. It's something. Here it's referral to usual care, right? In their context, it's getting the voucher that the person would have gotten anyway. And thinking about how you structure that is an important part of thinking about that challenge. And then finally, the last challenge for this particular study, I'd say, is, right, it's a particularly long-term study, so persistence of making sure to support the process with regular interaction, regular updates of right, interim results along the way, and such are important ways to make sure that is sustained to the completion. So what are we expecting to benefit out? So that's a lot of challenges. What are we going to get out of this? I mean, there's the direct objective of this thing. Evaluate rapid rehousing for singles, right? And so we'll get some good information about that at the end of this process. But it's important to have other things that we're getting out of this because it's a big effort, right? And I think that this idea of continuous improvement along the way, which was referenced by the previous group, I think is really important, right? Key mentioned, right, there's this triage process of a scoring tool deciding who gets into which program. And there's some question even about, okay, how well does this thing do in predicting the likelihood that somebody's going to be homeless? It's used by places all over the country. How good of a job does it do in actually predicting who is a good fit or who is likely to be homeless? That's something that we're learning along the way, right? That's not necessarily the express goal of the evaluation, but the same data that we're collecting is able to answer that question. So there's opportunities for continuous improvement in the context of the larger project. It's also the case that doing one project is an initial stage of relationship that builds the foundation for working together in the future. The first one of these is always the hardest to do. And so one neat thing that's been neat about working with Key and his group, right, is that we're now doing 2 of these evaluations, because now we were sitting down talking about, like, hey, what are other things that are going on that we might think of doing together? It provides a platform to think about other options, and doing it the second time is easier than the first. So with maybe the last minute, I'll give, we were asked to give a little bit about advice about forming these partnerships. And a lot of the advice I would have given, I think, has already been covered, so I'll just give one additional piece of advice, which is that I think when you're doing these partnerships on both sides, both the researcher and the practitioner organization, identifying the right partner is incredibly valuable. Because a lot of it is a relationship built on trust. Eventually you have to get to a point where, right, from a researcher point of view, you are trusting a practitioner to implement things that have been designed. And on a practitioner view, you're trusting a researcher that when they give you an answer to this question at the end of the day, that you're going to believe it and run with it, right? And that requires a lot of trust. And so over time, the thing I think I've learned the most is looking for a partner who has humility. And I think that goes both ways, right? I think looking for an academic partner who is able to identify that there are lots of things that they don't know and things that they need to learn from the caseworker who's working with somebody every day, right? It is an important part of a collaboration that involves listening and learning and revising the design. And similarly, having a practitioner partner who at the outset says, yeah, there are some things that we don't know about our program that we think data can inform, and that we're going to respond to that. That having that humility on both sides, that mutual humility and ability to listen and adjust, I think is incredibly important in making these things work in the end. Thank you so much.
Great, thank you, David. So I think these 2 studies are great examples of within an existing policy space, how can you think of developing and actually testing alternative policies which better implement the policy objectives that you have in mind. So let me start with the question to the Creating Moves to Opportunity team. So given the status quo policy moving towards the interventions that you've designed, who are the people who benefit the most from your study and who are the ones who sort of lose? And this is partly related to the question Sandy asked in the previous panel, that there's a potential negative selection going on in your study because those who are self-selecting to volunteer for the study may not be the ones who actually benefit the most. So going back to how sort of, those housing authorities which didn't pop up on your map, how should other housing authorities think of these distributional consequences when deciding whether to adopt your policy or not?
Do you want me to jump in?
Yeah, let me.
Okay.
Yeah.
Or do you want to start?
I'll start.
Okay.
So one of the things I didn't get to talk about was that when I was doing those power calculations, I was thinking, okay, maybe we'll have enough of an effect that we'll be able to conclude that this program was successful in moving people to opportunity. And I didn't imagine that we would ever have enough power to look separately by subgroup. But one of the side effects of the effects being so large is that we could actually look and say, how about people that were homeless originally, or that were non-native English speakers, or that were from various subcategories of minority races, or had parents with various educational categories. And in every category we looked at, we were able to find that it actually had sizable effects. And so it wasn't the case that this really works for our white families or our non-homeless families or the families that had the highest kind of baseline income. We were buoyed up by the fact that it had large effects kind of across the board. Sandy's question about and pointing out Eric Chin's work about negative selection into the program is something that you actually see across various things like in charter schools. That's certainly the case. And for us, it was exciting that our consent rates were so high, in part, I think, because, as Sarah mentioned, we weren't asking people to give up any choice or any option that they were going to have in the future. So that led us think that the people that we're estimating our effects on actually are representative of the broader population that are families receiving vouchers in Seattle. And so that let us think a little bit differently about the selection question. At the same time, it's going to be important to see the same thing that works in Seattle might not be something that works in Atlanta or in Fresno. So it'll be important to see kind of going forward how this works other places and what elements are more important to other places.
Yeah, I think another one of the results that has been heartening, in addition to those subgroup variations, because we were very concerned, especially for our refugee and immigrant community, would this work? And we were really, I think, heartened to see those subgroup results that Christopher was talking about. The other result that I think has been really interesting for the housing authorities is that we don't yet have persistence information, but we do have satisfaction survey data for families that we asked, how satisfied are you with your neighborhood and how likely are you to move 6 months after they had moved in, right? And families in the treatment group were significantly more likely to be both satisfied and to say that they wanted to stay in their neighborhood. Now, not all of those families moved to opportunity areas, right? About half didn't, but they were all feeling more satisfied. And I think what that speaks to is that perhaps those families felt like they had an opportunity to just have someone hear them and be more thoughtful around, like, what do they want in their move process? They've been sitting on a wait list for a year, 2 years, 3 years at this point. They have a voucher. The voucher can be used anywhere in the county. So having somebody to have that conversation with and then to help open doors around where you want to go, that may actually help families to feel more satisfied in their neighborhood regardless of where they choose to move. And that's a real success, right? Regardless of whether families have moved to one of the blue areas on the map or not. So I think that's something that we're excited to continue to dig into, and in the qualitative work especially. I think that because we weren't asking families to make a trade-off in this case, it's not a complete corollary to those MTO comparisons, right? This wasn't the only way that families were going to get a voucher. They were all going to get a voucher. It was just a matter of whether families wanted to participate in these optional services. And I think we've had a fantastic service provider who, is saying, hey, do you want to meet at McDonald's? Do you want to meet at the coffee shop? Do you want to meet where you're currently living? And talk about where you want to move now that you're going to be getting a voucher. And I think this is some of the families' perspectives that have come through in the qualitative research. Families just feel very heard. I think that the nonprofit agency has done a fantastic job of being incredibly family-centered in how they're approaching this and really letting families drive the process as the expert in where they want to live and then following and supporting their lead. I think that how we take that strategy and apply it to families who are current voucher holders is a little trickier, because obviously getting to the top of the wait list is a moment, and it is a discrete or concrete moment, right? And so I think one thing that it's not necessarily folks who don't benefit, but I think is just more of a challenge in how we operationalize this potentially, is for movers with continued assistance who are not necessarily at this moment because they've been receiving voucher already, but potentially not in the neighborhood that they feel good about.
So let me ask a follow-up question, which is partly related to what David mentioned in context of their study. So you mentioned in the paper, which didn't really go into the details in the talk today, is that, and again, correct me if I'm wrong, is that an increase in assistance, the whole package, is about $2,600 per family. So which means you're adding more resources to this. And so when you think about scaling up, you're going to have to take away resources from somewhere else. So have you had those conversations, and what are your sort of preliminary thoughts on what you're seeing?
Yeah, I mean, I think that this isn't as expensive as I think that the resources that we're investing in this, I think we only wanted to try things that potentially could be taken to scale, right? So that they are not exorbitant. That said, they are more resources. And not unlike Santa Clara, there's a zillion people who need housing assistance. And so we've struggled with this, right? Do you put more resources into services, right? Or do you figure out how to just expand the voucher program writ large? And I think it's a balance of somewhere in between. But I think that largely one of the motivations to this is we know that there's so many improvements that can be made to the voucher program, in this case with pretty light investment, right, that can probably have really huge intergenerational impacts and can really shift the needle in how we're providing that assistance. So obviously the pendulum can't swing fully to one side or the other, but I think this gives us better insights into some of those shifts that we can make to make the program more effective.
Maybe I'll add just a couple quick things. One is that $2,600 cost works out to something like 2% of the expenditures HUD would make for a typical family over the lifetime of their voucher. And so then in that context, it seems like, okay, so if we just increase the cost by 2%, we can potentially have much better outcomes, to the extent that it's not at all clear that, so one of the nice side effects, and Key mentioned this, that one of the value propositions you make sometimes is that there are offsetting gains financially elsewhere to stakeholders. So as a family grows up in an opportunity neighborhood, and if they have 2 or 3 kids, and each of those kids is earning $200,000 more over their lifetime, that's going to be much greater tax revenue, to the extent that it's not at all crazy that this could almost pay for itself. And that's before we've refined it to be the more cost-effective version, where we try to pare down and say, okay, can we be a little bit more precision medicine instead of broad-spectrum antibiotic, and target exactly the barrier that's kind of the most important for these families. So I think the ongoing potential to refine the cost even further, and then also the context of understanding the fact that there are financial benefits to the taxpayer from this, helps alleviate some of the concerns about should we be funding this. But what you hit on is a fundamental concern that I think we've talked with internally about, and as I've talked with other public housing authorities about, is this trade-off between services and more vouchers. And it's really hard to know exactly what that trade-off should be. It's even more hard to know what that trade-off should be without knowing what the effect of more services would be. And so that's where we see our study contributing.
All right, great. So a question from David. You don't have results yet, but you had one statistic which you didn't talk about today in the presentation, which is, and for the benefit of the audience, is that out of the $1 trillion spent annually on anti-poverty programs, only 1% is spent on programs that are evidence-based. Right? So that kind of was what was in your presentation. So I just wanted to kind of go back to that. Also, in giving a context, so this year at the Federal Reserve Bank of Minneapolis, we sort of celebrated 50 years of partnership between the University of Minnesota and Federal Reserve Bank of Minneapolis. Sort of basically, having the research and the policy arm more from the macroeconomic side, but having that. So it kind of struck me that. So I just wanted to ask you about how is that calculation made, and sort of basically a more general question to the panel is, when you think about these evidence-based programs, what do you really have in mind, and how does that affect the way sort of you go forward in your partnerships?
Yeah, it does depend a bit on how you define evidence-based, right? Because there's a spectrum, and I want to be clear about that, right? There's a spectrum of evidence, and all of which is useful and answers different questions, right? So the randomized control trial is, I don't want to sort of be the guy who has a hammer and is just looking around for nails. What can we do an RCT with? But I think there is a sense in which, right, we do have lots of, the fraction of anti-poverty spending that we have that is connected specifically to something where we say, okay, we have high quality impact evidence that the impact of this thing is what we think it is relatively small. Now that doesn't mean the other 99% is not effective. It just means that we don't know, right? There's some portion of that that's really effective, and there's some portion of that that's not effective. And so I think part of the goal of doing this type of work is to say, okay, for that other chunk of things that's out there that we don't have as good of information, we suspect that we have other pieces of evidence that give us reason to think some things are more effective than the other. We have good qualitative information, we have good descriptive information, but we don't have a clear sense of here's what happens with this program, and here's the what if. Here's what would have happened if this thing didn't happen, if we did the usual a business as opposed to that, right? I think that's the place where we're missing a lot of information, right, on knowing what sort of difference this is making in people's lives. And that's the place where I think it's really exciting to use these type of tools, because then we can start finding because I think there's a negative and a positive way to think about that, right? The negative way to think about this type of evaluation is to find things that don't work and then let's get rid of them, right? And that's sort of the fear-induced way of doing this type of evidence building. There's a much more positive lens to bring to it, to say there are things out there that people know about, like the Baltimore Housing Mobility Partnership. Like, people look at that and say, from the descriptive evidence, like, that looks like it can make a huge difference in people's lives. And then you say, but it's not quite. We don't have a full sense of impact because we don't know what would have happened to people in the absence of the program. And we say, okay, let's come in with impact evaluation and measure that much more precisely, get a much more concrete answer of how much of a difference this thing makes. And then we can start having that conversation about, oh, hey, this thing may pay for itself, or rapid rehousing. Hey, if this has impacts on part of why we're measuring things related to criminal justice and healthcare is because those things are really, really expensive. And from the cost study that he and his group did, right, we know that users of the homelessness services system use those other services quite a bit. But we don't have a good sense of how much you could reduce those if you get this versus if you don't. And so I think this type of evidence, what it adds is that type of idea of impact, and I think that's the piece that we're missing the most.
So just a follow-up question. So in certain sort of studies, for example, school vouchers, there are different studies which are done in different contexts. In some contexts it works, in context it doesn't. It depends on what the underlying sort of distribution of population and context is. And so for the housing authority folks, when you're thinking of adopting a new policy and you have these contradictory results, how do you weigh the results to actually think about, should we even try this policy going forward, and collaborate with researchers in sort of understanding whether it will work for you?
I think that I need a minute to think that. I think that in large part, I think when there's these contradictory policies, I think that in a large part, I think that there's often an assumption that, were those policies really looking at the same thing that we would be testing here? And so I think, to David's point, I think we haven't necessarily set up things to learn from them and to really have the impact evidence, whether it's an RCT or not, effectively often, and that's why we have this wealth of sort of programs that have been launched that we don't have good evidence on. And so I think one thing that we are really trying to do at the Housing Authority is set things up, whether it's this RCT or in other ways, just set up how we are launching policies to be more thoughtful of what we can learn from them in the long term, right? Because I think that it's not necessarily that there's this sort of suite of contradictory but sort of trusted evidence, and it's a matter of saying we're going to pick this or that, right? I think it's still very, very murky.
All right, so I think I should stop asking questions and open it up to the audience. So, Alessandra?
Thank you. Alessandra Fogli, Minneapolis Fed. So I find, the presentation fascinating, and they clearly show how these programs are important, how the place is important for individual outcomes. On the other hand, now we're trying to think about policy, and we're trying to sort of use these findings to inform policy. So in this conversation, we sort of took the map and the opportunity neighborhood as given, and we are thinking about moving people where there are more opportunities. But likely, these opportunity neighborhoods are themselves, endogenous and the result of some composition of some effects at the neighbor level. So for policy, it would be important also to know where these effects are coming from, right? Because when we move people around, we change the composition of the neighborhood. And so somehow we're probably going to also observe changes in the map that we just started with. So as we move people around, the composition of the neighborhoods will change, the pressure on housing prices will change. We will go back to the other panel, wondering about affordability. So you sort of have all these other effects going on that somehow we have been abstracting from, thinking that the place is given and that the opportunity of the place is a feature of the geographic place, but it's actually probably not just a feature of the geographic place, but of the people that live there. So moving them around has, long-term consequences, dynamic consequences that policy should take into account. So I'm just wondering about how on the ground, practitioners trying to think about these dynamics, general equilibrium effects that eventually are going to, display over time.
This is something that I've thought a lot about and talked a lot about, so maybe I can chime in first. The first is that empirically, a neighborhood's role in economic mobility is much more stable than you would think and than I would have thought ahead of time. And so we looked at places where there's been tremendous job growth and lots of gentrification, and the neighborhood seems like it's really changed. And it has, especially visually, but not so much for what happens if you're a low-income family growing up there. So to the extent that we can say how much our neighborhood's changing over time, they actually seem to be fairly stable, which suggests that there's this fundamental attribute of the neighborhood, and we could talk about what that might be. But I also agree with what Susan and Morris were saying, that we really have to adopt a yes, both, and approach. So we want to think about what's the right mobility strategy and what's the right place-based strategy. And in terms of general equilibrium, that's something that Morris thinks a lot about in his models. In our setting, if you think about where those green pins were on the map that I showed, where people were moving, they're so dispersed. And given the size of a metropolitan area and the unfortunate small size of the voucher program nationwide, it's just hard to imagine that dropping a few families into each of these neighborhoods is going to meaningfully change the composition of the neighborhood, whatever makes that effect, or even the affordability of that neighborhood. Now, we'd like to scale that, and we'd like to have a greater voucher program, and that's going to be in the future when we can convince Congress to appropriate more money to the housing safety net. In the meantime, we want to spend the dollars that we are spending smarter, and we also want to learn about the most effective place-based policies to be able to implement those. I think those have much greater possibility for having scale impacts. If you can take a neighborhood and you can improve the lives of everyone that grows up in that neighborhood, that's obviously going to have a much quicker and broader and greater impact than moving some people around that are participating in a program.
Yeah, I think just to add to that, I think one of the motivations, and I think this builds on your points about sort of building these relationships as part of a platform that can be built on over time, is that this was an opportunity to delve more deeply into our mobility programs and how to use the maps for that. But I think we were very optimistic that that research relationship and those tools would also be really useful, instrumental in how we could be more thoughtful about our place-based programs. And so I think ultimately those relationships and those tools are things that can be looked at regardless of where on the map that you're pointing to.
If I could just add to that, we need more arguments to advance sort of the housing interventions that we believe are necessary. So this isn't just about a housing choice voucher program, but we want to develop affordable housing, income-restricted housing in sort of high opportunity zones. The barriers to that are, of course, all the land use issues that was discussed yesterday, but also sort of a funding policy questions, right? In California, the Tax Credit Allocation Committee is sort of prioritizing production, just number of units, right? So that means that they're sort of deprioritizing or decreasing subsidies for units that have deeper affordability or have higher construction costs. So an acre of land in Palo Alto is probably like $10 million an acre, and in Gilroy it's like 4. So, but if we had arguments that this type of policy has long-term impact for the community, not negatively impact the community, and has long-term, lifelong impact for the residents, those are more arguments that we could use to sort of advance the solutions.
All right.
Hi there. This question is for Sarah and Chris. So Chetty's research demonstrated that the younger the child was, the higher the outcome, the earnings outcomes were at the end, at the end of the study. So Did you prioritize? I noticed that you had your criteria being up to 15 years old, and I think I remember a graph that he had that showed that once you hit that sort of middle teenage years, there really weren't the same outcomes. So did you prioritize younger children coming into the CMTO study, and if not, why not? And then my second question is, what type of MOU or agreement do you have with the educational system in order to track the educational outcomes per the sort of priorities of the Bill and Melinda Gates Foundation and the funding that they're using? And is that agreement sort of replicable or scalable for other jurisdictions that may want to look at doing CMTO in their jurisdictions but have this sort of data sharing challenges?
So you're absolutely right in terms of that that declining effect among age, and so it's less than 15, and we chose that sort of after consultation with the academic team. Where would we wanted to be informed by the research there, and it seemed that there wasn't a clear line of demarcation, but under 15 where the kids were going to have the biggest effect. Now, certainly a lot of families who are coming into the program also have teenagers already, and so one of the things we're really trying to suss out is, did those families move, and what have the teens' experience been like, especially kids who are 15 and older. We did not do prioritization in that under 15 group with preference for the very young kids. And then, Chris, do you want to talk about the long-term data sharing on the education? Or
I haven't been super involved with that. We do have an MOU with the Department of Education. For the state or for the city? For the state, maybe.
For the state. So there is an agreement that that Opportunity Insights has to get education data from DOE. The housing authorities also have separate data sharing agreements with most of the well, not with all, but with many of the school districts that we work with. For this, we decided to really pivot to the academic team's data sharing relationship as opposed to that being funneled through the housing authority, because most of those things will be longer term and they'll be tracked sort of in perpetuity when the housing authority won't be essentially involved in the sort of data mechanics.
But you don't have issue collecting that data from the families who are in the study to be able to track those educational outcomes?
That's part of the consent that families sign off is the back end, their consent to share administrative data that's going to DOE. Yeah.
Another quick question on that project. So who did you go to provide the additional services? Was it like the local housing counseling type nonprofit people, or?
Yeah, so we have a fantastic nonprofit partner called Interim CDA that provides the navigator services, but finding them has, there wasn't just an obvious choice for that, because for these services, we really needed someone who could balance being very family facing and understand how to support families' experience in the housing search process, and also be very landlord facing and be able to work in sort of that business to business relationship. And at least in Seattle and King County, that did not exist. And so
rental broker meets social worker.
Yeah, exactly. And even the rental broker notion is not something that is super prevalent in Seattle and King County, unlike other places. And so what that meant was that, we thought very critically around sort of what were the parameters we put into that RFP. And then once Interim was brought on board, they were very much part of that formative design process as we were building this out. And I think it is not sort of a standard, the housing authorities subcontract to Interim, but we are working so closely with them as we are with the academic team. It's not that we've just outsourced it and they're running with it. And that's partly so that they can be making pivots based on those incremental learnings that we're hearing from the academic team. And also we do bi-weekly learning circles with them to make sure that that information also gets back to the academic team. So it's a real dialogue.
All right, Ben? Sorry, I'm going back and forth. All right.
Thanks. This question is also for Sarah and Christopher. Christopher mentioned that there were some neighborhoods that looked great in the data as a high opportunity neighborhood, but that there were good reasons to not include them. Could you describe the process by which you uncovered those reasons, and then give some examples of the reasons that made you not classify a neighborhood as a high opportunity, even if it looked that way in the data set?
Yeah.
So one of them was contiguous areas. We didn't, so maybe there's others that you can talk about, but that's an easy one to explain. So if you look at the map, it's a little bit of a patchwork, and if we had an area we would want to basically put confidence intervals around what we scored each census tract as. And if it seemed kind of random and arbitrary to the families that like this street, but not that street, but then this street again, we were worried that it would like kind of weaken the fidelity of this concept of an opportunity area. And so we did a little bit of smoothing to try to be able to present to people, okay, here are the areas, and to make that presentation a little bit more sensible. That was one of the iterations that
Yeah, I think the other is that as we looked at the maps and the opportunity, the earnings forecasts that were in the maps, we also were looking at where were their current concentrations of voucher holders, and where was their current housing stock. And because we wanted to make sure that we were identifying opportunity areas that had sufficient stock, we also wanted to make sure that we were really identifying areas where we assumed there was a barrier, that the families were not able, either because they weren't aware of it or they didn't have resources to get in the door, for any of those sort of myriad barriers that we outlined. So there were a few opportunity areas in Seattle primarily where we already had a large number of voucher holders, and so we did not end up including those in the map because those were places people were already moving. I think that the more surprising sort of elements of the maps were places that didn't show up as opportunity but were very high income, and so they were places that sort of they had been assumed to be high opportunity for a long time. And I think that disconnect was something that was more challenging to overcome. And then on the flip side of that, there were areas that hadn't shown up as opportunity in sort of prior maps and often ended up were sort of more moderate income communities that did show up as high opportunity. And I think that led to sort of a more diverse map than we've had previously, and I think was really, really honored by families.
Right, on that note, unfortunately we don't have any more time,